So I'm going to do a really quick intro bio on these three fabulous people up here. Dante Hollis. Dante Hollis, raise your hand. They know you are. There he is, Dante Hollis. Dante Hollis is a life care specialist at Grady Health System, where he works directly with patients and families navigating pain management, addiction risk, and recovery support. In his role, Dante bridges the gap between clinical care and compassionate education, empowering patients with knowledge and resources they may have never received otherwise. Dante also has been an ambassador for Usher's New Look and worked with thousands of youth across the country. A little side note, I've known Dante since he was, is it 13 or 14 years old? 13 years old. Met him when I work with Usher's New Look, which, and he is a graduate and an ambassador of the program, and he graduated college in Detroit and relocated to Atlanta to be a life care specialist. So it's a real cool backstory. We're gonna write a book later about it, something, I don't know. Okay, Jeff Breedlove, I'm a huge fan. Serves as a CEO for the American Addiction Counselors Association and a strategic policy advisor for the Georgia Council for Recovery. He is also a member of the CWC Alliance Advisory Board. Jeff is a tireless advocate for recovery. He has dedicated his life to advancing policies that support people and families impacted by addiction. He travels across Georgia, listening to communities, building partnerships, and challenging the stigma that too often keeps people from seeking help. Jeff Breedlove. All right. Phylicia Hancle is the program director for CWC Alliance, our new youth prevention network. She is leading a groundbreaking initiative to train and empower young people as leaders in substance use prevention. With her passion for education and her commitment to equipping the next generation, Phylicia brings hope that we can stop addiction before it ever begins. Welcome. I'm going to get my questions. Okay, we are going to start the first question to Jeff Breedlove. Jeff, you're in long-term recovery.
Yes, I am.
I would like for you to give, in 3 minutes or less, how would you decide, I know some people out there are laughing, how would you describe the disease of addiction?
I am Jeff Breedlove, and I am a person in long-term recovery. And I was in active addiction for 30 years, and I've known the Hope and Joy Recovery for 8 years. First of all, it's a fact that it's a brain disease. We know it's a brain disease. We also know that amazing strides are being made medically from the brain science part of this disease. But we also know that what makes it cunning and baffling, which is a phrase some of us know, is that it's also not exclusively a brain disease. For most people, not everybody, it's usually tied to some type of childhood trauma. So how do we balance the science of the brain with the feelings of life? And there's no magic answer. There's no cure yet. But the disease is deadly. And like we saw in the video, the age of recreational drug use is over. When I was out there 8 years ago, I'd never heard of fentanyl. I never thought I would die. They wanted me as a repeat customer. And what I would say to somebody is the disease is the number one thing killing Americans 18 to 45 than anything else in the United States. It will destroy a family. It will destroy a person. It is drop dead serious business. But as deadly as it is, recovery is real too. And just in Georgia, there's some 900,000 people in recovery. Now, right now, there's about 1,300,000 people in Georgia in active addiction. But it's a disease that we have to also get straight about. It needs to be addressed more, frankly, as a medical issue for a majority of people than a law enforcement issue for a majority of people. Certainly, some people need to go to jail. No doubt about that. But right now, I think too many people are going to jail that need medical attention. The last thing I'll say about the disease is until the federal government and the state government in Georgia have the science of their own reports, governmental reports, giving the stats of people impacted, until those scientific numbers match our funding numbers, the way they do for AIDS, the way they do for cancer, the way they do for Alzheimer's, we will continue with addiction to see more deaths than we do graduations, more tragedy than we do celebration. We've got to prioritize the disease of addiction as the number one policy issue in the United States for government and businesses.
Amen. Like that. Thank you, Jeff. Okay, this next question is for Phylicia. CWC is piloting a new youth prevention network to train young people in substance use prevention. Can you share what this program looks like and the impact you believe it will have?
Absolutely. So CWC Alliance, in partnership with Resilient Georgia, we are so excited to roll out our youth prevention network, and it is exactly that, a network. It's a statewide initiative, meaning that we're not just going to one area, one urban center. We are including partners from all across the state of Georgia to train young people. Young people are our most important resource. They are our future, the people who are going to grow up and take care of us when we get older. And so we just want to empower them and also empower the adults who work with young people to be able to properly and sensitively train and educate this generation about the dangers of opioid misuse and fentanyl poisoning. As we have seen, that it's incredibly, incredibly dangerous, and some people just do not know about it. Our goal is that we are going to empower young people. They're not just recipients of services, they're actually the leaders, the change makers. So we empower them with information and resources so that they can share it and spread the news that way.
That's awesome. Okay. Dante, your work with Usher's New Look, how do you talk to youth about addiction and the fentanyl crisis? And I know you've got many siblings as well. You're the oldest, right? How do you talk to young people? How do you approach them?
Well, first, hi, Mom and Dad, if y'all ever see this. I would say I meet them where they are. A lot of the time, there's a stigma that kids cannot comprehend information that we feel like they don't, that they are not supposed to have. And working in Grady, I see a lot of GSWs. So there's a lot of times these youth are coming in there and they don't know what they're taking or how it's affecting them. So whenever I'm kind of able to say, hey, listen, we kind of talked about it briefly in the panel, well, not the panel, but early in the programming about they know the street names, but they don't know the actual hospital names. So if I say, have you heard of Percocet before? And they say, yeah, I heard of that. I say, yeah, that's an opioid. Oh, man, my friend just tried to give me 2 of them. No, that's not what we're doing. And sometimes you have to remove that, I always say badge off. You have to remove that layer of, I won't say parental guidance, but more so like, I want to understand you, not talk at you. And whenever they feel like you're talking with them and not at them, it makes them a lot more receptive to any information that's being provided. So I always just say, listen, man, I'm your friend. I'm here to help you. I'm here to give you confidence, but also making sure that you can spread the love and education to your friends and families so the same mistake isn't happening.
I know sometimes I talk to parents, they say, what do I do? How do I inform my kid? I said, well, actually, you're probably not the one, because that's the last, and you think when we were young, right? The last person we listened to was our mom and dad. And so it's better to think of an aunt or an uncle or a coach or a neighbor or someone they respect and look up to, but not mom and dad. Sometimes we're not the right one. So, all right. Jeff, how do you think stigma impacts people that are suffering with substance misuse and how it also affects families?
So I believe that stigma is the most dangerous part of the disease. It's more dangerous than any substance at all. And stigma nearly killed me. I am very blessed to be alive. I was so sick, and I do want the younger folks to know that when I was in active addiction, for the most part, we didn't have cell phones. We certainly didn't have smartphones. And the culture of the whole society was a little bit different. It was easier to go off the grid and couldn't track each other and all that. So I would disappear for long periods of time and do what I did and came back. And when I would come back, the last thing I wanted my bosses, I worked I was not an elected official, but I worked for a lot of them and some pretty high ranking ones. And one of them was a member of Congress who had been a United States attorney for Ronald Reagan. And, he told me to review the Clinton Gingrich crime bill because the speaker told him to review it to make sure they were okay with it. And so there I am looking at it politically and policy-wise. We had a lawyer looking at it legally. And, you know, I'm like a true believer. Sure. We got to the crack cocaine part of the bill. And I said, oh, absolutely. We want to put these people in jail for 20 years. Understand what I just told you. I told a member of Congress to go tell the speaker, to go tell the president that our side was perfectly fine with putting me in jail for 20 years. That's how bad the stigma was. I would rather my boss think that I don't even know what crack is really than know that that's my drug, the drug that I'm using. I mean, think about that. That's how sick I was and how ashamed I was. And I wouldn't seek help. And then when the disease caught up to me and people were saying, Jeff, maybe you should try to, I'd be like, oh, I'm good. I'm the one stronger than the drug. And I'm here to tell everybody right now that here's this. You're not the one stronger than the drug. The number one thing they told me when I sought treatment at a place called MAR, which saved my life, was surrender. And then they taught me about a higher power. I choose to call mine Jesus Christ. You're not stronger than your higher power, and you're not stronger than the drug until you surrender. So stigma is deadly. Now, for families and society, you know, it is not theoretical. I have a friend from college right now who texted me yesterday. She now has a daughter in college at Pitt, or she was at Pitt until yesterday, because she started going through some issues with my disease. And it got out of hand, and the police were involved in suicide and threats. And she was just embarrassed and humiliated, and the family was embarrassed and humiliated. But she and her husband decided to do what they had to do to save their daughter's life. And I'm telling you, the daughter got on an airplane yesterday in Pittsburgh with her family and some medical folks to go to a treatment facility. But at first, my friend was ashamed about a week ago. And it took her a few days to realize she had a choice. And I'll end with this. If you're a family member, and my son is sitting right here in this audience, and I love him dearly, you have a choice as a family member. You can either worry about what people think of you, or you can go save your loved one's life. But that's pretty much where we are today.
That was powerful. I always say it's not the casserole disease. When Christopher would be in treatment, I never told anybody, and I really could have used a casserole. You know, like I really could have used a neighbor to say, hey, can I get anything for you? Are you okay? But I hid it. And it can be, like you said, deadly for the one suffering, but the families, you need support. So the more we talk about it, the more we share our stories, that helps break the stigma.
Can I say one more thing about that?
Absolutely not.
We're sitting here on September 18th, and Cammie, I was already impressed with Cammie, and I knew CWC was a big deal. But one thing that drew us together was today is the angelversary, right?
His birthday.
His birthday. It's also my wife's birthday. And so I just thought that was very much a bonding thing, that they share September 18th is important to both families. Embrace and hug somebody you love.
Thank you, Jeff. Don't make me cry up here. Okay, that was Jeff. Okay, Phylicia, you're next. What do you believe is the secret sauce to reaching our young people about the dangers of fentanyl?
I truly believe that the secret sauce for young people is empowering them to lead themselves. Like Cammie said earlier, when an adult is talking at you or telling you what not to do, oftentimes that piques curiosity. We can see sometimes that might actually have the opposite effect. What we can do, though, is tell young people what they can do. You can educate yourself. You can learn about these things. You can share it. You can learn about ways to cope with root causes like anxiety, depression, digital wellness. You can learn how to infuse mindfulness into your day. You can learn how to connect. One of the things that is true in this day across generations is that a lot of people are lonely. A lot of people are not connected, and that isolation can lead to heightened depression, heightened anxiety, like me right now. And the truth is, there are evidence-based practices that can be implemented to help people be well. And so the secret sauce is telling them how to do that for themselves. But then also, young people, they're influencers. Like, we are in the digital age. They're online. That's the way that they connect sometimes. And so the secret sauce is empowering them to share it with their peers.
Which I love. So part of our grant is that we are actually paying young people to be trained. So they get paid like a job to be trainers, and then they go out and train the youth. So I'm so proud that you're our youth director, I gotta say. Woo, Phylicia. She used to be with Teach of America, right?
Yes, I was a teacher. I was a science teacher for a few years in Atlanta. That was lots of fun. I love the kids. I really, really do. Those are my babies.
All right, Dante, do you have a patient story that stands out to you specifically that you could share with us today?
Yes. So they're both pretty short. One of them was a 19-year-old who was admitted for a GSW. It's known as a gunshot wound. I got to see the patient over a little bit over 2 weeks while he was in the hospital. The patient didn't have any family coming to see him. And being in the hospital, it's a lot on you mentally, spiritually, and physically. And sometimes going through that anxiety, as they mentioned, or that depression, it can, on top of the medication, it can send you into a mental spiral. So just to be able to sit there, give them confidence, practice some of the CRIM skills, that's from the Trauma Resource Institute, teach them that mental mindfulness, teaching them breath work, meditation, just these different skills to give them a sense of confidence was one of the biggest goals that I wanted to obtain throughout that entire time. I was getting ready to leave out of Grady. It was about 4:30. I'm not gonna forget this because my heart was beating. It was about 4:30. I was getting ready to leave. And I heard somebody say, "Hey, Grady is not. It's a different environment down there. So if you ever been down there, you understand." I'm from Detroit, Michigan, so that was a more of an aggressive A. So I was a little more alert. Like, okay, here we go. And he came up to me. He was like, "Hey man, you changed my life. You saved my life." Now I'm frazzled because I'm like, hold on, man, you was just yelling at me. I'm trying to remember your face, but it's been so long since he was discharged and he was coming back up for a follow-up. He was like, man, just you teaching me those skills, teaching me about the medication that I was taking, it helped really save my life and help me go back and tell my little brother not to do it. It helped me change my ways. He actually got enrolled to go get his CDL. So that was one of the biggest things. And then the second one was a much older gentleman. He was about 33 years old. And family was there. I love doing interventions when families are present because it does allow us to work as a unit. It allows me to educate them on what medication their family member is taking, and then also they can practice the skills together. This particular patient was kicking everybody out, told the nurses to leave, told the doctors to stop talking to him, kicked his family out. I was like, just let me talk to him, give me 30 seconds. First time, he dismissed me. The second time, he started to open up. By the third day, he was in full-blown tears, literally telling me everything that was going on, what he struggled with, how he wanted to change his life for the better. So being able to give him that confidence, help him change that narrative, and give him that mental confidence was a big win for us and the team.
You know why I love the stories. I love the stories. It's my favorite. Okay. Jeff, from a policy and systems level, how can prevention programs like this strengthen our state's response to the opioid crisis?
So, we talk about that a lot because we always talk about we're reacting, we're downstream and we need to be upstream. So prevention plays a big role in the evolution of this disease. So from a policy perspective, and I only have 3 minutes, so I'll be brief. The most important voice, the voice of the stories, really does play a big deal in advocacy. And I'm here to tell you that first of all, the most important words in advocacy are thank you to somebody when they stand with us. Like we had Representative Hatchett in here earlier and the Attorney General in here earlier, and they make decisions about what? At the end of the day, it's about our civil liberties and our taxpayer dollars, our money. So first of all, don't forget to say thank you. But before that, we have to show up and share the voices of lived experience from peers and family members. Where? Well, yeah, it's great to show up in Congress. And sometimes Cammie and we might ask you to do something with Congress. Sometimes we'll ask you, actually, like with an RCO, the Next New Beginnings group, they might ask you to do something at the state capitol with us. And that's great. But the most powerful words are, I'm a constituent and I vote for you. And everybody in this room lives somewhere. And where you live, you have a city council and a county commission. And you have a district attorney and a sheriff, right? And the mayor's with your city council. When's the last time you've been to a meeting? Last week. Okay, you don't stop.
You don't count.
Security. No. Listen, at those city council meetings and county commission meetings, they have public comment time. And I've been a staffer. When I was arrested, and yes, I was arrested. I've real street cred. 3 days in the DeKalb County Jail. So watch it, because I know people. It's true.
No, he did.
I do know people.
Just do that.
It's right there in the jail. But here's the thing. Before I was in the jail, I was the chief of staff to a county commissioner who we got the funding for the jail, for the sheriff, because we were their commissioner. We were the police department's commissioner. We were the fire department's commissioner. We were the 911. That was who my boss was. Okay, and then I get charged with a felony. And let me tell you what, when I sat at those county commission meetings, every single week, people would come up. They'd usually wear like the same T-shirts. And they would say, we want this in the budget. We don't want that in the budget. We want this law passed in DeKalb County, not that law passed. Until we start showing up and letting our public officials know what we want, they're not going to know what we want. Going back to stigma, why in the world would an elected official support a group? You know what stigma means to an elected official? Because I speak political language. I speak English, Southern, and political. Those are my 3 languages. To a politician, stigma means controversy. Politicians tend to run away from controversy. So until we show up and they think we got their back, they think their community cares about it, why in the world would we expect them to give us funding and vote for us? So if you want to lead the way, find somebody on the prevention team, the treatment team, the recovery team, and start showing up in community saying we're united together. We want prevention, treatment, and recovery, funding, and laws.
That was really a good closer, but we're not closing yet, Jeff. But that was great. Thank you, Jeff. I'm going to take it back to the youth. Phylicia, what have you seen so far? We've been surveying around the state with youth and with adult counselors. We've worked with their current knowledge. When you come into a room and do a survey, what do they know about the fentanyl crisis? Do you feel they are aware? Do they know the word? Do they know about naloxone?
So the truth is, youth tend to know or can identify the word fentanyl. But the truth is, they don't know the danger of it. They don't know the risk. They don't know what dosage is potentially fatal for them. And so what's important is to increase their toolkit or their backpack so that they know, like, I am not going to introduce drugs into my life because this potentially could be mixed with another substance. And so we've seen that knowledge is very, very low, and it's probably because of the time that we're in. And so I'm excited, honestly, with the team to go across the state and to train these young people and to let them know. It's important for them to know. Like Dante was saying, sometimes we don't think that youth are resilient, but they truly are. They're very strong, and they actually want to know. Like, they want to know what's going to be damaging to them, and it's better to give them the ounce of prevention at the beginning.
Thank you. Dante, from your work as a life care specialist at Grady, how have you seen addiction affect the patients and the community that you serve?
I see it as that's a great question, because I see it in multiple ways. Some are resilient in the sense of they want to have all the resources that they can to help their loved one. And then some you do see a sense of hopelessness. So anytime I get a chance to interact with a patient who has no clue what they're taking, I always ask this one question, and it may sound funny to you guys, but I say, when was the last time you had a bowel movement? And typically they'll say, I haven't had one since I got here. And I'll say, okay, how long you been here? Just to have that rapport with them. They say, I've been here for a week. I say, you know, that's typically the common side effect of taking an opioid. I'm not addicted. Don't tell me that. I said, hey, do you know what an opioid is? No. Have you ever heard of Percocet? Have you ever heard of oxycodone? Have you ever heard of morphine, Dilaudid, Tramadol? Oh yeah, they just gave me some morphine this morning. So that's why you're not using the restroom. And then just being able to give them that education, it also allows us to communicate more effectively with the nurses. As mentioned before early in the program, and nurses and doctors are in and out of the room constantly, so there's not really a lot of time to have that rapport built to say, hey, how is this really making you feel? What's really going on? Because a lot of the times we see the anger, and we see the frustration, and we see the lack of education, and that allows us to kind of fall into that stigmatism where we put people in these boxes, especially in certain communities. So being able to come in and educate these patients, especially those who had a past or who is being current resilient, it just allows us to give them multiple pathways for more resources.
I'm going to keep that mic. I'm going to keep you going with that.
Okay.
When you educate the patients on the dangers of opioids, what has been your experience? Like, how many patients would you say truly didn't even really get that they were taking an opioid? Like,
For sure.
like you just said, they know the street name, right? So I guess you did kind of already answer that. You know, and we talked earlier with Dr. Mara, 70% of the patients with the clinical trial didn't know they were taking an opioid. And let me make sure we're clear. There is a time and place where you do have to take it. There is a time and place. But if you're on, you need to know how fast to taper off. That's the main thing. Yeah. And overall, honestly, every human being needs to know how to be their own health advocate. Because you're going to eventually, unfortunately, that's life, right? You're going to have a health crisis, God forbid, or a family member, and you need to know that health advocacy of what questions to ask your doctor and not be afraid to have those conversations, right? And to really become your own health advocate. Okay, we're going to wrap up with, let's see. Oh, yeah, sorry. Yeah, go ahead. Sorry. Well, I thought you kind of did, but then I asked it again, so you can add to it.
Close to Dr. Shanker's numbers earlier, around that 70%. So if I'm blessed to see maybe 12 or 13 patients a day, I would probably say 8 out of those 13 don't know what an opioid is. They heard of the word. They heard of it. They couldn't tell you exactly what they were taking and the common side effects of it. So anytime I do get that first initial interaction, my goal is to not talk at you, is to talk with you. I want you to understand what you are taking. I want you to know how this is affecting your body. And then also teaching them to be an advocate, as Cammie said, for themselves. Say something, if the medicine is not making you feel okay, speak up to your provider. Or you speak up to me, and then I can also have that one-off conversation, say, hey, they've been experiencing a lot of the side effects of this. They want to know if they can tailor to something like an ibuprofen, an Advil, or an aspirin, something that's less harsh on their bodies. So around that 70% mark.
So guess what one of our number one things in our toolbox is for anxiety? Coloring books. Adult coloring books. We can't keep them in stock. If you want to donate some, please let us know. We'll let you know. Yeah, see, please. Coloring books and music therapy. And there's so many wonderful free apps out now, for sleep. Sleep is big. Everybody has a hard time sleeping in the hospital. A lot of people have a hard time sleeping when they're home in their own bed. So we try to give a lot of tools to help with sleep because that's such a key part of getting better as well. So let's go to Phylicia. Why is it so important to engage youth early in prevention efforts, and what ripple effect do you anticipate with this program?
Absolutely. The goal is to increase the amount of protective factors that our youth have so that they can stand on their resilience. When they have all of these protective factors, these things in their toolkit, then the likelihood of developing risky or adverse or harmful behavior will decrease. Not only that, it actually empowers them to become advocates and to choose. I get to have the choice. And one thing we know about young people, they always want independence and they always want freedom. Early childhood, from the age of maybe 2, 3 years old, we see that kids want to walk in their own, they want to do it on their own, they want to pour the water by themselves. And so it's important to empower them. Our program, and I think a lot of programs across the state, really focus on youth empowerment because we need to give them the choice to protect themselves. They need to know that they can do it, they need to be pushed to do it, and they can. And the truth is, they want to. I think there's also sometimes a stigma of like, what is it, Gen Z? Like the young ones, they're just rebellious and all of these things. But the truth is, they're our future. And that same rebellion, we can reframe that thought to being the fact that they are our leaders, they are independent, they are self-starters, they are motivated. So yeah.
You know, it's interesting when I talk at schools, I say, you know, you had nothing to do with this mess that we're in, but it's up to your generation to solve it and to fix it and to be accountable for it, right? So if you are on social media, Facebook, Instagram, you need to be following Jeff Breedlove because he is a pro. When I tell you, and when I look at and I try to catch up, and I see this man all over the entire state of Georgia, and he'll be in 5 different cities in one day. I'm like, how did he do that? So there's a Georgia recovery bus, and it's going in, I think, 75 counties? 75 stops, okay? I've been on a few, but you've been in all of them. The Georgia Recovery Bus is outside after the conference is over, but I want you to tell us, Jeff, why do you travel across Georgia in the recovery, and what impact you have seen with bringing communities together with the Georgia Recovery Bus?
That's a great question. First of all, I want to point out that there's members of the bus team here, including there's somebody right in front of us, but right there is our bus tour manager, Jasmine Turner, right there. Yay. And Jack Breedlove and Sam Lord are right here. They drive the van behind the bus. Nice. And Sam's got on this blue T-shirt. If you come over to Cruz Plaza tonight on campus, the bus will be there. We'll have a concert with Blackline Reggae. The lead singer, Eric, is a guy in recovery. And we're giving out free T-shirts. There'll be free food. Macon Recovers is our local RCO, local partner. So after this concert, before you leave and drive away, just walk over to Cruz Plaza, get a shirt, and
sign the bus.
Sign the bus if you haven't, and get some free food. Why the bus? Well, the bus is funded with the graciousness of Governor Brian Kemp and Commissioner Kevin Tanner and the entire team, and there are some of them present at DBHDD. And I don't have time to give you the 5 minutes of how awesome they are, but I will just tell you this. There's a lot of states who their equivalent of DBHDD is not peer and family friendly. They actually are hostile. We are so blessed to have a commissioner and a team that is not just friendly, they are leading the nation for this disease and people impacted by it. It's also funded by the General Assembly, of course, the Working Group on Addiction Recovery. What's the mission of the bus tour? It's simple. According to the commissioner, we're doing 2 things. We're breaking stigma and showing communities that recovery is real. Let me give you 2 quick stories about how it changes the world in a real community. So we were up in a city, I'm going to not name the city, up in North Georgia the other day. And there are some people in the city government that don't necessarily want to give zoning to let a recovery community organization have a brick and mortar place in the city. And that's called stigma. Well, some other city leaders came to the event and spoke at the event and saw what? Heard stories of family members in that community impacted by this disease and the reunification that occurred with one family in particular. And everybody was crying. These little high school kids were speaking and the grandma spoke and everybody spoke and the whole family, it was a whole thing. And when the night was over, this one city official, well, actually 2, talked to the lady started in the RCO, and they said, we've had it with the people telling you no. We're going to go have a meeting with them after this and tell them it is high time to get recovery in our city. That's a real world thing that happened because the bus tour came. One more bus tour story. when you see that bus, take a beat and look at all the signatures on it. And you'll see the following. And this is where I get a little emotional. You'll see some people that have a date by their name. And for those people, that's usually the date of their recovery, if you will, their sobriety. Then you might see somebody else with another date. And that's usually the date of the angelversary of their loved one. And there's probably, 10, 20,000 signatures already on this bus? Easy. The bus itself becomes a story of what's going on in Georgia in 2025 to families. It talks about the reality of the loved ones we've lost. It talks about the reality of the hope and joy. There's messages of hope on there. There's little drawings of art on there. And all of that is a manifestation of what? Stories, of feelings, of real Georgians. So when you go sign that bus, if you do, I hope you do, look at those things. The bus itself becomes the story of recovery in Georgia.
Thank you, Jeff. I hope you all come out this evening. It's going to be a lot of fun. I'm looking forward to it. Okay, Dante, what is the one thing that you want people to leave here today with?
I would say lead with empathy. We are all dealing with life in our own matters, and sometimes whenever we are encountering people, we don't know what message they can take from us. So I always try to lead with empathy, and I want to encourage you guys and invite you guys to maybe try to incorporate that when you are dealing with difficult situations or when you are dealing with someone who's dealing with active recovery. Understand that life is a different starting point for everyone, and just because they took that one pill, that doesn't have to be the end for them. So give them the empathy, give them the confidence, but also give them the love and the education that they need to continue to fight this fight.
That was beautiful. Sorry, you got to follow that, Phylicia.
I know. What I'll say is a quote from Brene Brown, and it says, "Connection is why we're here. Purpose, it adds purpose and meaning to our lives." My charge for everyone today is to try to connect. Slow down, connect. As far as the young people, your kids, your nieces, anyone that in a youth group that you may have the opportunity to connect with over lunch, breakfast, whatever, ask them what they know about fentanyl and share a fact with them. Listen to them in a non-judgmental way, because we're not trying to stigmatize what's happening, but listen to them. See if there are any myths that you can dispel and share information. Connect with them. Allow them to have a trusted adult that they can go to when things are tough. Position yourself in that way and just lead with empathy, like Dante said, but focus on connecting.
One thing, Jeff, one quick thing, because we're going to open up for questions. You got to be real quick.
What I would tell you is this. Addiction's real and it's deadly and it's killing more people, as we saw in the documentary, than wars combined, 747s crashing. But do not forget that recovery is also real.
Oh, that was good. That was really good. Do we have any questions for any of the panelists? Yes, ma'am. And Glenda, do you have the hand mic? Oh, we're going to do two questions real quick. Possible. Sorry.
So this question is for Jeff. I love your emphasis on recovery being real as well. How accessible is treatment to a regular person on the street?
So I would say this. That's an area that we have to continue to do better on in Georgia. But it is fair to say that Georgia, with our tax dollars, has put more money into the whole spectrum, prevention, treatment, and recovery than frankly any other state in the nation the past 6 years. So as not perfect as it is here, it is better than most other states here. I will tell you the one thing we have to do better. Our General Assembly passed a parity bill, which simply put means we passed a state law telling insurance they have to follow federal law, which was embarrassing enough. But we have to make sure that the parity law is enacted by all the parts of state government. And what parity is in one sentence is, if we go out here in this lobby and fall down and break our leg, we all know if we go to the hospital is going to fix our leg. And we don't even think twice about it in America. But if we go out in this lobby and have a mental health or a substance use episode right now, insurance companies are refusing to pay for that for working class families in Georgia. So we have to enforce the Parity Act so families can get the treatment they're legally entitled to under both federal and state law. And frankly, one last thing, we have to support and lift up our providers who are doing it the right way in Georgia and make sure in your communities you're talking about the good work they do so families know they're there in the first place.
We're out of time, but I'm going to squeeze in one sentence, and I might get in trouble with Glenda, but I'm going to do it anyway. So I want to give you a gift because I keep forgetting to give gifts, and you ask a question, and it is a drug safety box that you can lock up your medication, and if you can't use it, you can give it to somebody to pay it forward, okay? That was a gift. And the one thing that I want to leave, because I think this is the last time I have the mic, so I got to use it well. So first of all, I got to really thank very, very quickly my own team, because my leadership team, Alexandra, you see my leadership team, Carter. I mean, you don't understand. There was so much planning with all of this work and all my life care specialists, but my leadership team here, we would not have been able to flow today. So thank you. I also want to thank, of course, I've talked about my Shiro and the Mercer team, but what's really important, my last moment here, is the naloxone that's in your bag. Yes, do I want all of you to read my book? Yes, that was 18 months of grueling writing. Read my book, but that's not really what's in that bag. The most important thing is naloxone, because you can save a life. And really, there's always a lot of questions around it. Like, what if I administer it and somebody's not having an overdose? It's not going to hurt them if you administer and they're having some other issues. So you're not going to hurt them if you give them naloxone, okay? And just share it. If you don't think you can use it, Dean Sumner was talking about, she took it down to a group of church ladies and they were all in their 80s, and she thought, are they really going to want this? And they wanted it for their grandkids. They wanted to take it for their nieces and their nephews. So everyone should own naloxone. It should be where there's a fire hydrant. It should be in libraries, dormitories, accessible everywhere. That's the situation that we're in. So that would be the thing I would leave. Thank you all so very much for being so involved and engaged in today's conference, and I appreciate the panelists. Thank you.
Thank y'all.